When scientists develop a vaccine for COVID-19, we need not worry about Belize's access to a fair share. That's because of a global effort to ensure that all countries, no matter what size or income, have the same access to vaccines. The World Health Organization coordinates it, and it's called COVAX. On Wednesday, the Pan American Health Organization shared the latest updates on this facility.
COVAX will be the best viable option that countries will have to access COVID-19 vaccines in the short term. That's why over 182 countries and economies around the world have joined this initiative. We're also happy to report that virtually every country in Latin America and the Caribbean has joined or is in the process of joining the facility.
Belize's Director of Health Services provided that update at Friday's press conference.
It would be for 30% of the population. The initial down payment is $382,000 that have been paid, and the remaining $2.1 million is payable once the vaccines are available.
And that availability will be until the vaccines meet the standards of the World Health Organization.
Today, we have a pipeline of more than 180 vaccine candidates under study, with 11 in phase 3 clinical trials, and several of them including volunteers in our region. While the world urgently awaits a breakthrough, it is important to highlight that PAHO will only support the distribution of a vaccine that has proven to be safe and effective in clinical trials, reviewed by national regulatory authorities, and recommended by the World Health Organizations.
In addition to assisting in the region's COVID response plans, PAHO has now expanded its efforts to ensure that countries are prepared for when a vaccine is approved.
Most recently, these efforts have focused on ensuring that our region has equitable access to a safe and effective COVID-19 vaccine, and that in the meantime, countries have the systems in place to prepare for, to distribute, and to pay for this vaccine once it arrives, so that populations are protected as quickly and effectively as possible.
Locally, Dr. Manzanero has indicated that a COVID-19 vaccine in Belize would be distributed similarly to the yearly flu shot.
It will mimic what we are currently doing with the flu vaccines, of which we have 40,000 doses, which means healthcare workers go first. Then you have to look for the vulnerable populations, people older than 60. The flu vaccine, I'm using that as an example, children under 23 months, pregnant women, hypertensive, diabetic, kidney failure patients, HIV patients, cancer patients, and that's how your list is expanded.
Not only is this a vital part of reducing the impact of the virus on health systems, but because we know that with COVID-19, no one is safe until everyone is safe, protecting our most vulnerable populations is key to getting back to normal as quickly and as safely as possible.
While we wait for the vaccine, PAHO's director, Dr. Etienne, urged member states to continue their efforts in reducing transmission.
COVID-19 cases are plateauing across much of Central America, with Costa Rica presenting the highest incidence rate during the last week, and Belize reporting a steady increase. In the English-speaking Caribbean, most new cases are related to non-essential international travel. Last week, Grenada reported its first new COVID-19 case in 3 months, coinciding with a reopening of its borders. These resurgences underscore that fighting this pandemic is not a one-time effort. It requires a sustained response, even in places where transmission is down. We must keep it up. It's as important now as it was in April, and it will be even more important once we have a vaccine. Together, we can overcome COVID-19.